What's a skin assessment? So basically, something that nurses are in the hospital are required to chart on is the patient's skin. This is a big deal on admission. So the thing is this kind of is half comes down to payment, half is, standard practice. So basically, if a patient comes in and you don't assess like, hey, they came in with this wound from the nursing home. If it's not documented on admission, then it is essentially like the hospital gave it to the patient, and then insurance companies and like the government, CMS will not pay for those, the care of those wounds. So they can end up being very costly for a hospital. Most hospitals require a head-to-toe skin assessment of patients on admission. So that means looking at all of your skin to see if you have any wounds, particularly like on your backside. Like if a patient was laying in a bed for a long period of time, they would have a wound, skin breakdown that would require treatment. So this is a big deal with patients who have limited mobility, not as much for those who, walk around and are very care for themselves or ambulatory, that kind of thing. So lots of things can happen to skin from various disease processes that make it so they break down easier, that make it so, if they're not being turned or not, getting the right nutrients like protein and whatnot, that their skin can break down easier. So it's important to make sure skin is intact, and also the side of it of like, okay, we need to see if they've got any wounds. And a lot of people are not able to see all of the skin on their body, so might not know that they have wounds that do require care. So you have to like look everywhere, include, under folds, behind, on backs and on back sides and feet and behind ears and those kinds of things to assess for any wounds, to make sure they get the treatment they need, attention they need, and then also for documentation as it relates to cost and reimbursement and insurance and all that jazz.